Hi, Janice. I'm Tim
Hi.
Wilton. I'm
Hi.
the medical director of the National Joint Registry, and I wonder if you would like to give us a little bit of your background, what you do, and what your work is and has been.
Well, thanks for that, Tim. I'm a nurse. I've been a nurse for well past my sell-by date for nearly 50 years now. Most of that time's been spent in oncology nursing in a variety of roles. My retirement job now is as an oncology nurse specialist, which is really where my roots lie and a job that I really enjoy, albeit that I'm doing it on a part-time basis.
And tell me what caused you to feel that you may have come to the point where you needed to consider a joint replacement?
I think it was really a throwback to sort of having ongoing problems with my knees. As a child, I experienced recurrent dislocation and had some surgery, about 50 years plus ago. So that tells you sort of it was a very, very long time. In recent years, my knees, and particularly my left knee, had been giving me grief. And as a consequence of that, my right hip was beginning to play up. The orthopedic surgeon who looks after my knees suggested that I went and saw one of his colleagues about my hip. And when he did a scan and some x-rays, it showed that there was a small area of bone on bone and a little tear in the cartilage. And he suggested that getting my hip sorted out through having a replacement might help my knees to some degree. If not, at least it would be my hip sorted going forward.
So, when exactly did you end up having this operation done?
I'd come back from a holiday and it was beginning to sort of really niggle. I think I'd put it through its paces with walking and it was limiting me in what I could do. So I went to see him again and ended up in having my hip replaced in March of this year.
How did the consultation part of this process go on as far as you were concerned?
So reviewing the scan and looking at the x-rays that I had on the day of the visit, he suggested that I probably would be looking at a hip replacement.
And do you feel that he gave you plenty of information to allow you to make that decision? How
Uh,
did that happen?
yeah, I mean, very much so. He went through the type of hip replacement that would be appropriate for me. He showed me the different types of hips. He talked to me about potential complications and potential benefits from having it done. So I felt that I'd been given sort of both stories, the positive and the negative, on which to actually make the decision. He did send me some information about hip replacements, and I knew a little bit about NJR, particularly the decision making tool. And I'm thinking, gosh, I'm ticking a number of those boxes now.
So you looked at that tool before you decided to have the operation.
Yes,
And was
yes,
that a helpful sort
it
of
was actually. Yes.
good? So perhaps can we move on to later on in the process? So has your view about how much information you were given or obtained changed since? Would you rather have found out things that you didn't find out, or perhaps even not known about things that you did find out?
No, not really. I think that when I went back, sort of thinking this is a route I was going to go down, I spent a reasonable length of time with the surgeon. He was excellent in the way that he went through things, sort of quite relaxed in the way that he was discussing it. Absolutely no pressure on me to have it done. He showed me the device again. He talked about sort of physio before and physio afterwards, talked about sort of the recovery period, the anaesthetic. I must admit, I wasn't very keen on the idea of sort of having a spinal because I'm very wimpy. I don't want to see anything, smell anything, or hear anything. And he sort of chuckled at that and said that was between me and the anaesthetist. But he didn't have any strong views either way. But he did, I remember him clearly saying that there was evidence to say that you have better pain relief if you don't have a GA and have it done sort of up under a spinal. Yeah, eventually that was the route that I went down. But in terms of the hip itself, I felt that this was something that he did on a regular basis. And I felt that it was probably the right decision for me because things weren't going to get better by themselves.
Do you think that there's any advice that you would like to give us as surgeons that we could perhaps modify our approach to give patients a better idea of what was going to happen?
For me, it was useful seeing the device. He gave me the information, and if I wanted more, I could ask. But I didn't really want sort of loads of in depth with sort of like how long it's going to take to do the procedure. I think I already had an idea of how long that took. And that to me is immaterial. You know, you're not really going to be sort of, even if you have it done under sedation, you're not really going to be in the zone for how long it takes. Um, Staying in hospital, I think I was a little bit surprised when he said you could go home the next day. And for me, living by myself, I was a little bit nervous about that. But when I said I live by myself, he said, well, you can stay in yet another night. You won't be discharged until you're fully ready. But he did say to me the importance of having someone at home for the first few days. So as I was asking questions, but I didn't feel rushed in the consultation at all.